Hello everyone, I'm Mark Tarr, President and CEO, and I'm at our Lakeshore Rehabilitation Hospital here in Birmingham, Alabama this morning for the third quarter update. This update is going to focus on you, our workforce, and our most valuable asset for this company. 2 years ago, we made a decision to centralize certain aspects of the recruitment function in order to help supplement what the hospitals do. So now we have a really good collaborative approach between the talent acquisition group in the home office and the hospitals and what they're doing in terms of recruiting staff there. So we've had really good success in recruitment this last quarter. As a matter of fact, we've hired over 200 net new nurses, which is really kind of tied for what we did for the second quarter, but I think is really indicative of the effort both at the hospital base and the home office base through talent acquisition and what we can do working together. Our goal is for every hospital and really the home office too to make every employee feel like they're valued, that this is a good environment, a good culture that they want to be a part of. And if you look at whether it is through our DE&I initiatives, where we are working to make sure that our recruitment efforts work with everything from HBCUs to targeting different colleges and professional programs that might be out there and be a good resource for potential employees and staff, bring them into our company. We recently included Spanish-speaking captions to many of our videos. So these are just indications of our prioritizing to make sure all of our staff feel like they're valued and they're part of this overall culture we're trying to build as a company. So in addition to our recruitment efforts, retention is a huge focus. And part of that retention is how can we provide opportunities for our staff to continue to grow, both professionally and in a sense in terms of whether it's clinical or non-clinical, their ability to work up within the organization. And one of the recent things I'm really excited about, within the last 30 days, we've announced our new clinical ladder for nursing, which has been in the works now with a group that have been developing it. We recently announced it at our CEO meetings. We're very excited about that. If you look at our DF CEO program, that's been a huge program in terms of developing future CEOs that help support our growth as an organization. And if you look at what those CEOs that came through that program have achieved, many of them have now continued to grow, not only as CEOs, but CEOs that may be in area positions. So we are reaching out in a lot of different ways, looking for people to hone their leadership skills, looking for people to hone their clinical skills, any way that we can help support our staff to feel like they continue to grow within our organization. Really the best way for employees of the company to feel like they've had their voices heard is through taking and responding to the employee engagement survey. Matter of fact, the next opportunity to do that will be October 30th. So we really want to have a high participation rate. We take those scores, we look at the surveys, we hold ourselves accountable both at the home office and at the local hospital level for looking at the areas that maybe we didn't score as high as we would like to and areas for opportunity. So I encourage all of you to engage with the survey and give us your thoughts. The third quarter was another good quarter for the organization. If you look at everything from just our overall volumes and the continued demand for our services is very strong. We had a nice trending in terms of our labor costs, which has been elevated for the last couple of years. So that's kind of where that recruitment and retention has come into play for our organization. If you look at our quality outcomes, they've never been better. So I'm very proud of the way the company performed, and I'm very grateful for all the contributions of our staff in terms of helping us achieve what we achieved collectively as an organization in the third quarter.